For more than a century, Akron Children's Hospital and the United Way have worked to save lives and help those in need in the greater Akron community. As we look ahead to the next 100 years, it is more important than ever that our organizations work together for the families and children of our region. To continue this legacy of giving while creating an even greater impact for years to come, we are introducing an exciting new collaboration. Akron Children's Hospital and its foundation and the United Way of Summit and Medina's partnership for the community. Tell us about the ways Akron Children's and United Way of Summit and Medina currently work together in the community.
Yeah, absolutely, Shelley. I mean, to your point, we have such rich history, our two organizations together, and we're so proud of that. Most recently, we're coordinating on a VITA program, which is Volunteer Income Tax Assistance Program, with your employees and your clients at Akron Children's Hospital, which has been really fantastic so far. It's really just providing free tax services to people in the community. Through 211, we have a great relationship there. Employees and clients of Akron Children's can call 211 at any time and get more information. I know Akron Children's is really involved in Akron Public Schools college and career academies. United Way plays an integral part in that as well. So we really kind of are the connector between the schools and the businesses to help to create those connections and career pathways for kids in Akron Public Schools. Through our Center for Immersive Leadership, I know your employees have engaged really richly and deeply in a lot of that work to really build the community's next leaders. Finally, and obviously, our infant vitality initiatives, we're both really ingrained in kind of really focusing in on those social determinants of health and what really creates healthy and happy moms and babies. And I think we're both invested in that work. So on so many different levels, our organizations really collide in really beautiful ways.
We take great pride in our responsibility to help the kids of the region grow up healthy and safe. But we know that sick kids and families need more than just our expert care in terms of behavioral care and medical care and surgical care.
Sure.
They need support services of various types, and the Family Resource Center is a hub for some of our services like interpretation services. Family and patient relations is organized there. We have our safety center there that provides baby locks and gates and gun safe devices. So it's really a hub and a nucleus, but we've also been able to reach out and partner with organizations like the United Way that have very synergistic goals. So the United Way is there with one of their financial empowerment centers.
Sure.
And as Annie mentioned, they provide tax support, they provide help with credit situations and improving credit ratings or financial planning for our families. We also have Summit County there, a couple components of Summit County. We have Jobs and Family Services that helps families have access to food, enroll in Medicaid, with child assistance if needed. And we have Summit County's Health Department's WIC program, Women and Infant Children, which provides nutrition counseling and access to formula and food for young mothers with kids up to age 5. So I think all of those services that sick kids' families really need, it's nice to bring that there to a central hub and make it very convenient for them to access those services because they're just going through such a difficult time.
Right. Your bold goals.
Yes.
They're the focus of your work here at the United Way of Summit and Medina.
Absolutely. These goals were something that are community focused and were community driven, right? I mean, these are really something that the community has coalesced around. We don't just consider these our goals, but community goals to really focus in on these important issues. Goals 1 and 2 are specifically focused on APS children. And we're focused on 3rd grade reading levels with a goal of hitting 65% of kids at or above 3rd grade reading level. And then goal 2 is very much about graduation rates for APS students. So 90% and above with 60% college and career ready. And these key data points are really indicative of if these kids hit these goals, they are that much more likely to be successful, to move on to a career, to establish a really safe, happy, and healthy life in this community. So these are really inflection points that we really want to focus on for kids in our community. Goal 3 is specifically focused on financial empowerment, like Chris alluded to. So we have a financial empowerment center with trained counselors who really focus on uplifting kind of the financial needs of those in the community, not just giving them some literacy tools, but really empowering them to improve their financial lives. So we have a goal of financially empowering 11,000 people in Summit County and then 2,500 people in Medina County as well right now. And then goal 4, as we mentioned, is specific to infant vitality initiatives. So our focus is really get to the Black infant mortality rate to 6 per 1,000 live births. And that's community effort as well, right? That takes a whole village to really focus efforts in all our specific areas to really make progress on that number.
Wow, amazing. I spoke earlier about the upcoming partnership between Akron Children's and the United Way. Chris, could you tell us a little bit more about that partnership and how neat it's going to be?
Yeah, I'm really excited about it.
Great.
I think it's a real win-win. When I first joined the United Way board, I got really passionate and excited about the bold goals because there's such overlap and synergy with the mission of Akron Children's Hospital. And as we started thinking about how we could partner, we had an interest in running an employee campaign that would allow our employees to pick their favorite cause at Akron Children's or fund and make a donation. And what's great about this program is they can really double down and get twice the impact for their money. We'll certainly benefit from the funds they give for us to build our programs, but we will also turn around and make a matching gift to the United Way.
Right.
And the employee can inform that gift. They can decide which bold goal they want to support by indicating that. So if I'm an employee and I give $50 to my favorite fund at Akron Children's, the hospital will turn around and give $50 to the United Way, and that'll be designated to the bold goal of their choice.
Tell me more about the impact those goals are going to have on the community.
Specifically, physical impact of what we're seeing in the community, I think, is kind of exemplified in our family resource centers, just like Akron Children's. We have some family resource centers inside of Akron Public School systems right now. We have 5 locations that were embedded inside the schools with a very similar model where kids and families can really come in and get all the wraparound services and support that they need to thrive in school, right? So kids are going to have a hard time learning if they have empty tummies, right? Or if they don't have new shoes that, are keeping their feet warm. So it's simple things like that that can really support children, kind of family stability measures that we can really kind of bring to the table to help support those kids. And I would say more broadly, every day 211 has a great impact in this community, right? Thousands of calls over the course of the year really come in and really give people resources, tools, referral systems that can really expand the work and give them that kind of the support they need.
That's wonderful. You're really meeting people where they are.
Absolutely.